Welcome to the Conscious Fertility Podcast. Today is a unique episode in that I am posting here on the Conscious Fertility Podcast an episode where I was the guest interviewed by Dr. Aimee on the Egg Whisperer. And she's really great at editing and keeping them short bites to about 30-35 minutes. And our original interview was probably close to an hour. So she was so kind to give us the raw footage, and my team edited it down to about 50 minutes. And so I wanted to share basically the full episode. And you can hear how Dr. Aimee and I talk about kissing your ovaries, and where she says healthy eggs are happier eggs. So find out what she means by that. Again, this originally aired on the Egg Whisperer, where I was interviewed by Dr. Aimee, and I wanted to share this with my audience here on the Conscious Fertility Podcast.
Welcome to the Egg Whisperer Show. I'm so excited to have my dear friend, Dr. Lorne Brown, on today. Welcome back, Lorne.
Thanks a lot, Dr. Aimee. I'm excited to be back with you today as well.
We're going to talk about something that I talk about all the time with my patients, and that's about conscious fertility and psycho-neuro-immunology for fertility patients. Whoever thought that there was such a thing? And I'm welcoming back Dr. Lorne Brown to the show, and I'm excited to have him on here to talk about this topic and new mind-body tools and methods that can support fertility patients. We'll also be diving into conscious fertility and talking about how mindset can help fertility patients on their path to pregnancy. Let me tell you a bit about Dr. Lorne Brown. He is the founder of Acubalance Wellness Center in Vancouver, British Columbia in Canada, and my patients adore him. He left his career as a CPA to receive a doctorate of traditional Chinese medicine, also known as TCM, at Vancouver's International College of Traditional Chinese Medicine, and then continued to pursue training in hypnosis, functional medicine, cold laser therapy, and Psych-K, allowing him to offer an integrative approach to assist the body's innate ability to heal pain, digestive disorders, anxiety, hormone imbalances, and reproductive health issues. Welcome to the show, Lorne.
Hey, Dr. Aimee, I'm glad to be back on again as well. And I always enjoy talking with you. And my patients adore you, by the way. They always tell me how they don't know how, but you always find ways to have time for them. They feel heard. You answer their emails. So kudos to you as well.
Thank you, Lorne. You're very, very sweet and very kind. Thank you. Let's do a quick overview on how acupuncture can be used in support of IVF and transfers. First of all, what kind of acupuncture do you recommend for fertility patients?
I'm actually not attached to acupuncture per se, although I'm trained in it. I'm a fan of anything that can help the cellular environment to increase blood flow, regulate hormones, lower oxidative stress, improve nutritional deficiencies, inflammation, mitochondrial health, so overall cellular health. And so when it comes to what kind of acupuncture, there's many styles, I guess, and the style that you're looking for, the goal is, do we see a regulation in hormones? Like, does the cycle change? If they have irregular ovulation, do they start to ovulate regular? If they have pain or clots or very light or heavy menstrual cycles, does that change? Because in Chinese medicine, a healthy cycle has no pain, no to minimal PMS, no clots, and you bleed 3 to 7 days. And so the kind of acupuncture I like is seeing people once or twice a week, and it's usually a good 3 to 6 months sometimes that we're working with them to see that shift in the cellular environment that shows up in the physical symptoms. One of them being the menstrual cycle, and the ultimate one is pregnant having a live birth.
So you're basically hypnotizing the uterus, is what you're saying.
Yeah, I'm hypnotizing them. I am trained as a clinical hypnotherapist, so it's funny you say that because I am doing that in a lot of my patients, which I call conscious fertility work. So I am doing the acupuncture with some hypnosis. So it's funny that you said that.
Yeah. I mean, the thing is, when I tell patients about acupuncture, I say, like, I really want you to look forward to doing it. I really want you to feel better when you come out of it. Because if those two things are satisfied, you look forward to it and you feel better coming out of it, then continue it.
Yeah.
If you're not, that might not be the right place for you. So it might be good to maybe get a second opinion or maybe consider another way of improving mood and decreasing stress.
Yeah, and I shared at the beginning, I'm not attached to the acupuncture, and I would say a small percentage, but there are some of my patients that the idea of acupuncture, or getting acupuncture, puts them into more stress. Most of them that have that fear, after 1 to 3 visits, they don't have that experience. So it does shift and it has that beneficial effect. But if somebody has that severe fear of the needles, I use laser acupuncture or herbal or diet. We do always the diet movement, but there's so many other things that we can do. And the goal again is to increase blood flow, reduce stress and anxiety, regulate those hormones, and to support implantation and reduce those miscarriages so we have a live birth. So yeah, and dosage matters. I just like to always emphasize that. I get a lot of patients that just come and see us on transfer day, but all we can do on that day is help with uterine receptivity. Seeing you whether you're doing ovulation drugs or an IVF before retrieval, that period of time, those 3 to 6 months before, is more ideal. And then if somebody has PCOS, endometriosis, inflammatory bowel disease, other underlying pathologies, then you definitely going to need more than just a treatment on transfer day.
Yeah. And then there are some studies that have determined that acupuncture has a positive impact on IVF. And you kind of discussed all the different things that you're looking for as far as the diagnosis. But what are some of those findings that you've read about or learned about through your work?
Yeah, I think since 2002, that's when it first started with IVF on transfer day. The most recent meta-analysis that I looked at the time of our recording was the one published in July of 2023, and they looked at over 4,700 people going through IVF having acupuncture, and their conclusion was it increased implantation by 28%, pregnancy rates by 33%. The most important one was live birth rate by 33%, and it decreased the risk of biochemical pregnancies by half. And also, there's been research where they've shown acupuncture during IVF setting lowers the anxiety level. So, and again, the mechanism behind it, what we're understanding is the stress levels, regulating the hormones, increasing blood flow. Who knows what else from a Western perspective? Because the Chinese had a whole different model of the body when they did this. So, anything through that integration to support the health on a cellular level, we're hoping for increased results. So that's one meta-analysis that is 2023 that came out.
So, aside from other things you recommend, like I know you're always recommending going to McDonald's for the French fries, getting the core of the pineapple, right?
It's a funny thing because you talk about the McDonald's French fries, but it
Yeah.
just reminded me of somebody I had on our Conscious Fertility podcast who is very healthy. His wife keeps him healthy. He's really into the spiritual side. And we got lost once. We were at a conference and he got lost and he was in my car and we had to get back. And I took him to McDonald's because it was the only thing available. And his wife, it wasn't a good scene when we got back. It's the first time he had McDonald's in about 20 years. But yes, you're referring to the McDonald's that is all over the web that it will improve your IVF
Yeah.
success and pineapples. And for those that are listening, I don't know what you tell your patients. I say the intention, the mindset. If you want to have those McDonald's fries today and you think it's going to help you, go for it. Just know it's not going to help you on a physical level. It's because one person who had multiple unsuccessful IVF cycles, that one time it was successful, she happened to have McDonald's that day. So she has that cause of an effect. So
Right.
McDonald's fries got her pregnant.
Yes, and I imagine she has a nice sponsorship deal now with McDonald's.
Exactly.
So it's like, exactly, it's kind of like an internet craze, but
Yeah.
it's not something that's real. But what are the things that are real? What are some herbal supplements? Do you have any favorites? What do you tell patients
Oh
to do?
yeah, I got some favorites, things that I've, through my at the time of this, 24 years into practice. So I want to remind us that the simple things are still the most important things. Small action done on a daily basis will lead to massive results. It's also often dismissed, but regardless of the acupuncture, low level laser therapy, the IVF, you got to move your body daily, right? So, movement, exercise, eating well, diet, adequate rest, deep, sufficient sleep. If you're not doing that, then those small actions will have a negative impact on your body. So that's one of those things. Don't dismiss those things. And then I like to use mind body work. I call it conscious fertility, but ways to elicit the emotional, to develop emotional resilience and to help rewire or change those old subconscious programs. I like to do that kind of work. I'm a fan of supplements, especially if there's certain deficiencies, which we often will test for. But if you ask me my favorite supplements, a healthy prenatal, a good prenatal, CoQ10, inositol. I like N-acetylcysteine as well. It's quite common that I prescribe for my patients. Omega-3, some that are not familiar for people, but they'll know this. Magnesium, I like magnesium a lot. And vitamin D3 with a K2 combined. And then depending on what endometriosis piece, whatever else is going on, we may add things. But if you ask me what are the most common five, those would be there.
Yeah, I usually share the exact same list with my patients. I usually add 2 more things for the patients who have lower egg quality or even if they don't, and that's NAD or NR, NAD, exactly, and resveratrol. So those are the two that I also add.
Nice.
So yeah.
And 2 questions on those, because
Yeah.
we get to go back and shoot the shit here, right?
Yeah.
So so the NAD, we haven't brought it into our clinic yet. There's oral and then there's IV. We're not confident yet that the oral is gonna do its trick. Our naturopathic doctor she's a little bit on that brilliant side. Part of the pathway, she has this concern that it's gonna get stuck somewhere on the pathway, so you're gonna have short-term benefit and then later issues. So she prefers the IV, but we just haven't brought it into the clinic. What are you doing and what do you think?
Oral is best.
Yeah.
I'm so funny. I am a brand ambassador for this brand, and it's True Niagen.
We're
And
familiar with that. Yeah.
so, yes, I think NR is the best way of increasing NAD in our cells. I'm 75 years old, Lauren. Don't I look amazing?
You do. I do. I would not think you were
You would not
75.
think so? I've been taking
Not to make it a competition, but
I
I'm 85.
holy
So,
shit, you beat me. You
yeah.
totally beat me. But I've been taking True Niagen for at least 7 years now, and I learned about it from a 43-year-old patient who had done
Okay.
multiple IVF cycles, and then she did an IVF cycle with me that
Mhm.
looked just like an egg donor cycle, and I was like, "What is this stuff?" And she learned about it from an animal study, and then I brought it into my clinic since then. And I reached out to the company. I was like, "I love what you guys are doing, and please, we have to tell fertility patients about it." And so that's like how my partnership started. So I swear
Yeah.
by it. And you can also do it IV. For women, I think IV causes us to have more symptoms from it. You get more jittery, more heart palpitations. I always tell people to start low and go slow. So start at 150 milligrams. There's powder sticks that you can start with if you're really sensitive. 150 milligram capsules and then slowly go up to 300. I actually take 1,000 milligrams a day, and that keeps the wrinkles away.
And then resveratrol, again, our naturopathic doctors that love to geek out, they like that one, but they don't do it for frozen embryo transfers because somehow it may impact with implantation. So they do it for egg quality, but they don't do it for getting close to a transfer.
1,000%. It's part of my beauty line
Mhm.
for the eggs. When it
Mhm.
comes to my beauty line for the uterine lining, I have a whole nother,
All different things.
set
Cool.
of things.
All right.
Absolutely. Absolutely.
I
Yeah.
have to tell you what I'm getting like little excited goosebumps as we chat because I'm thinking back to like in 2002 is when I really got into the reproductive health. I was been in practice since 2000, and back then REIs threw me out of their clinics, right?
Oh,
And
we're such dicks.
right,
We are
and
such assholes. And because of COVID, we are even more so now because they're like, oh, COVID, we're not going to bring you back. But yeah, I know.
well, it's different now. This is why I like talking to you because
Yeah.
and then, they used to tell people to get off CoQ10. They said, "We don't know what that herb is." And I'm
I
like, "It's not an
still
herb, it's an
do, Lauren.
antioxidant." But then time went on, and I mean, we're on site at the at all the fertility, so they built rooms for us, we're there,
Right.
so things
Right.
change. But
Totally.
why I'm getting goosebumps is I'm sitting here because I always wanted integration. I dreamed of the day that it was integration, and I'm sitting here, and you know about resveratrol. It's not that you heard about it, and you have, you know, your beauty line and your egg quality line and your and the implant. That's why I'm having goosebumps that here you are as an REI, and I know because we've talked, you know about low-level laser therapy, you know about NAD. It's just even so for the patients that are sitting here that your REIs are not integrated enough, man, you don't want to go back in time. You have no idea how good it is in 2024 when we're recording this. So I
It's
just want to say thank you
so
for
good. No,
doing
thank
what you've
you.
done to get because it's not part of your REI program.
Right.
So thank you for doing what you've done to become aware of all the things that are available to your patients. Again, probably why they adore you.
You're very sweet. I mean, the thing is, the easiest word to say in the English language is one syllable, and the word is no.
Mhm.
Can I take supplements? No. Should I exercise? No. I mean, that makes a doctor's job really easy,
Yeah.
right? So rather
Okay.
than actually like thinking about it, looking at the research, trying it on patients, saying no just, takes very little time. And teaching your nurses to say no on your behalf also takes very
Yeah.
little time too. Okay, so what are some of the mind body tools that some fertility patients might not have heard of yet? Because we learned so much about you, like low level laser therapy, all you. Now everyone knows about it. So, what are some mind body tools that we may not have heard of yet?
Yeah. Well, If you're okay, I'll probably get a little weird too, if that's okay. I
I'm
think you're okay with
totally
that, right?
into weird. Yeah. Yeah.
I
Totally.
like to live in both worlds, my head in the clouds and my feet on the ground. And I know we're going to talk about PNI later as well as part of this. So
Some people might not know that PNI stands for psycho-neuro-immunology, everybody.
sure.
Okay?
Sorry, didn't mean to offend
Not
anybody.
not offended.
Yeah. So the mind body tools, I kind of share with why they're out there, what I would look for. Cause I'm always like, why are we doing it? Versus like just like, do I need acupuncture? Well, what are we changing in the soil? What are we changing in the cellular environment? So why do we want a mind body tool? And so there is the materialistic view and the quantum view, the Newtonian view and the quantum view. So the materialistic, where we're going to talk about psycho-neuro-immunology, the physical shifts in your body from stress. And then there's a spiritual component. And on my podcast, the Conscious Fertility Podcast, I bring on credible people, as in they're trained in neuroscience, they're physicists or quantum physicists, they're PhD in psychology. So I know they're grounded in the materialistic view of the world. That's their training. And then they're also talking about this thing that's getting the term consciousness. And so basically the idea is there's more to this world than meets the eye. There's things that are happening beyond our five senses, call it the sixth sense. And this is where I say miracles happen, or you tap into your higher self. Okay. And so when I say talking about mind body tools, how do we remove this filter so we can access our higher self? And the metaphor I've heard other teachers of conscious talk about is, there's the sun, and you love the brightness and you love the warmth from the sun. But today it's full of dark clouds. So you feel cold and you don't feel the sun. The sun's always there, but in your mind, it's not there. I've lost connection to it, but it's there. And you have to go through the clouds or part the clouds to re-experience the brightness and the warmth of the sun. So any mind body tool, because there's infinite out there that can help you part the clouds so you can reconnect to your higher self, are tools that I would recommend. And there's many out there. And so the tools I use based on my training as a clinical hypnotherapist and trained in Chinese medicine, and then just all the other little certifications I've done in my own personal experiences, the Joe Dispenza retreats, I've done multiple of those, and the Bruce Lipton work. I just one day had my, I guess, call it access and my download. And I developed an approach that I call notice, accept, choose again. And the intention here is it helps you develop emotional resilience. Basically, it's how to be present so you can deliberately create your reality. And for the listeners that don't know, you've probably heard of the author Eckhart Tolle. He wrote the book, The Power of Now. He lives in my city of Vancouver. And when I read his book, can I share a cute story about that?
I
Just
want you
about being
to.
present? Okay.
Please. I think you're
So,
amazing. I'm already parting the clouds in my head right now,
okay.
looking at the sun, feeling very warm. So share away.
So the notice, accept, choose again, this approach that I have not given it a better term yet is NAC. It's not the NAC we're didn't
Right?
take up the supplement. It was how to now, because when I read his book, when you're present, you don't suffer and you have peace and joy. I was like, I want some of this. But I'm that left brain guy. You remember I used to be the CPA, and I was like, but how do I have this presence, right? And everybody I would learn from, I'm like, how? And one day after all the retreats, all the program, I'm a kinesthetic learner, so I go and learn these things, don't always practice them full time, but that's how I like to learn, is get certified in them, not just read about them, but and then practice with myself, family, and patients. And so I want to know how to now. And eventually one day it dawned on me that all of them are doing this: notice, accept, choose again. Since we're on the NAC approach, I'll just explain that then. Okay. So it makes sense. So when you go unconscious, you're at the effect of the situation, right? The external world is impacting you. And so you suffer, right? But if you can become awake, be conscious, then you can interrupt that story. And I can't think of the author right now, but it may come to me. But his quote kind of goes like this: every situation, you either habitually, unconsciously react, or you can consciously choose to respond. So in every situation. And the reaction that comes out of you is from your programming. You came into this life with some programs, and then based on your sex, your religion, your culture, your nationality, and then your parents consciously or unconsciously imprinted programs on you and society, and you develop these programs that you run. And your behaviors are always congruent with your beliefs. So that's why, if you try to lose weight, dieting is not going to work, because you got to go after the program. If you fix the program, then the behaviors will change, right? So we always like to work with the subconscious. Going to the notice, accept, choose again then. So what are all these teachers of consciousness sharing, in my opinion, what I distilled it down to? First thing is to notice everything that happens is neutral, and then we give it meaning. We're meaning makers. And the meaning we give it is through the lens of our subconscious programming. So if we change the lens of our program, the perception of what is happening is different. For example, let's say reality is white snow, but I have red glasses on, you have pink glasses on, this person has green, blue. Everybody is seeing the white snow, but everybody's perception is different based on their lens. So you change the lens, you perceive reality different.
And I'll throw in an IVF example. So you go in for your baseline ultrasound, you have an ovarian cyst. So you're going to see that and you can take it in different ways as a way to learn from it and say, I'm going to continue to take care of myself. Or you can take it and think of it as the worst thing that's ever happened into your life and allow it to let you spiral. Yeah.
So it's either, so you go, what you're saying is it's either happening to you, you spiral, or it's happening for you. However, be kind to yourself because your reaction to that ultrasound was not what you didn't choose that. That comes from your program, your lenses, and it is a supercomputer. Your subconscious is fast. Think about it. When you sleep, your heart beeps and pumps blood while you're unconscious. You breathe while you're unconscious. You may consciously pick up an apple, but after you chew that apple, the enzymes from your mouth, the acid from the stomach, the absorption, you're not thinking anything. You're riding your bike, you're driving your car, but the subconscious is doing all this. You've probably all have experienced where a ball or a crow almost hit you, and without you thinking about it, you moved your head. You didn't think about it. So just so you know, your reaction is unconscious. This is why we want to prune the wiring, the synapses of these old programs and rewire new programs. So in that quote, I said, in every situation, you unconsciously habitually react, and it's a program. You didn't get to choose it. It got imprinted on you, or you can consciously choose to respond. NAC is how we interrupt the story. And so we notice, and it takes practice. So the first couple of times, you're going to only do this an hour a day or a week or years later on an event that happened that you're still triggered by when you remember it. Everything that happens is neutral, and we give it meaning. Notice when you believe in the story, you make it real. So it's a story and you're believing it. I have a cyst and it means this, and now you suffer. So the second step, which is counterintuitive, is to accept what is. When you fight with reality, you create resistance. In Chinese medicine, we call this qi stagnation. When there's stagnation, there's pain and disease manifests. And when we have free flow of qi, we have health. And so resistance does not feel good, but when you can fully accept what is, and I have tools for this. So this is what I do in the A part. It's not like, oh, it's conscious work. It's working on the subconscious, that we surrender, accept what is. This lowers the resistance. And this is the key part. These uncomfortable feelings, fear, anger, not good enough, alone, they can act as portals to take us into presence. Now we go back to, Eckhart Tolle, be present. And when you're present, when the resistance drops and you're present, that feels good because you now have flow and receptivity, and now inspired thought can flow through you, which leads to inspired action. When you come from fear and lack, you will take action, but often that action will lead to more fear and lack. It's what is your beingness. When you take action from flow and receptivity, from that state of love and feeling whole and complete, you'll get more of that. So the key really is, how do we lower resistance? We accept what is. And again, beyond our talk today, but I use tools to help you get into present moment. Again, they're tools. I just use them. They're gimmicks to help you get there. Eventually, you figure this out and you can do it in real time. But at the beginning, some of us that are left brain, we need to do to get into beingness. Amit Goswami, who wrote The Quantum Doctor and the Quantum Integrative Practitioner, I interviewed him on my podcast as well. And he calls it do, be, do. And I was like, that's the NAC. We do to get into being. And then from that beingness, we can take action.
Right.
So the accepting is the key part, because the accepting allows you to lower the resistance, to surrender to what is. And it does not mean you're resigned to the situation. It does not mean that you like it. You're just being authentic. Right now, I feel afraid. That's it. And that takes the charge out of it. Sounds counterintuitive, but what you're doing is you're practicing or developing that ability to witness, observe, because your very nature is peace and joy. You are not your thoughts and feelings. You are not the cloud, the thoughts and feelings. You are the rays, right? And your very nature is peace and joy. And so by developing, strengthening, practicing the witnessing, which we do in surrendering, accepting what is, eventually you tap into what these experts that I have on my podcast call your higher self, something greater than self. And then it's just a knowing that comes through you, right? And that's when it feels like these hands from the universe, from heaven, come down and do things for you. All these synchronicities happen.
Yeah.
And then the choose again is once you're in a state of relief or peace, now you can deliberately choose again. So going back to that quote I shared with you, Viktor Frankl's quote, it's a modification of Viktor Frankl, Man's Search for Meaning. In every situation, you unconsciously habitually react, or we use NAC to erupt it, you can consciously choose to respond. So I was working with somebody the other day, well, every day when I work with somebody on the fertility journey, it always starts with the fertility journey. And then we gently, and I emphasize gently, regress back. Remember, I have some training in clinical hypnotherapy. It's never about the fertility. There's always some form of trauma from their childhood, and they heal that. And when that resistance comes down, now they get to choose how they want to be and feel in this world. And that's part of the rewiring. And now they're not coming from lack or fear anymore. And so that is the NAC approach. And so when you ask me what kind of different mind body tools, that's my style. But there's guided meditations I share with patients. We want the ones that have really good hypnotic language because there's guided meditations that will relax you, which is key. We need to relax the body, get out of sympathetic into parasympathetic, get out of high beta into alpha or even theta brainwaves. That's how you get into the operating system of the subconscious. So relaxation is good, but to really tap into that higher self, to tap into that supercomputer, we want to use some hypnotic language to get in there. So it's beyond just relaxation. And that's why I like some of the guided meditations that are out there that help relax you and then start to change the programs that you have been given.
Yeah. And your notice, accept, choose again method is very similar to the method I use for patients. So I always ask them, what do you want? What is it going to take? And are you willing to do it? So you have to notice what you want. You
Yeah,
have to accept what it's going to take. And if you're not willing to accept it, you have to choose again. That's
I love
just
it.
the gentle reality. And I love what you say about things are happening for you. So I teach my patients this float through life type of mentality. You can't fight the current. But if you take that float through life mentality where things are not happening to you, but for you, and you're just kind of going with the flow, your fertility journey will be a heck of a lot easier.
Yes, because you're going to get to whatever that destination is,
Yeah.
and you can either go kicking and screaming,
Or with the wicked sunburn. Just kidding.
right? Right? Or you can get there and it doesn't have to be suffering. And to use that analogy, that metaphor you just brought up, I often share, I have a blog post on developing emotional resilience, which is about this notice, accept, choose again. And what I share with the patients, the metaphor I've come up that works well for me and them is if you ever canoed or paddleboard and you're out on a calm lake, so that's you at peace, and then a speedboat goes by and all of a sudden these waves come. So life's going to happen. People think if I do this, I'll always be happy. Yeah, just want to change those expectations. Shit's going to come to you. Don't worry. The question is, how do you ride the waves? And what's supposed to happen as a human experience is when you have this situation, these emotions are meant to go through you 90 seconds to 3 minutes. But we have that, brain that we suppress it or we project it out. So it gets stuck in our tissues, right? And so it's constantly impacting and rather than have gone just through us and then we're back at peace. Back to the metaphor is it's counterintuitive. I remember when I was a young child and then when I was a counselor, when the waves came and my staff member said, everybody turn into the waves. And I was like, no, we should get away from the waves. And what happens is it's harder to experience those waves on the side of the canoe or paddle boat versus front straight at it. So it's counterintuitive to go into your emotions, accept them and experience them, observe them. It takes courage to feel these feelings because you still have to feel these feelings. It's just, I promise you, they don't last more than 90 seconds or 3 minutes when we do this work. And then when you're on the paddleboard, say, the waves still go up. So whoa, whoa, right? But you're okay. You're not being flipped over. And then eventually, over 90 seconds to 3 minutes, the waves pass, and now you're back on calm lake, and it's peace again. And sometime in an hour or 2 hour, another boat may go by, and here's whoa, and you ride the waves. You have an ultra. There's a cyst. Whoa, the waves. So ride the waves. We're not saying, oh, I have a cyst. That's great. We're not doing spiritual bypass here. We're being authentic. It's if you're angry, notice you're angry, accept you're angry. If you're afraid, and then the choose again. Once that relief happens and the resistance is lowered, then you choose how you want to respond.
Absolutely. And see it as something that's happening for you, not something that's happening to you, and use it as an opportunity to grow and to imagine those clouds opening up and feel the rays of sunshine.
The word is opportunity. Your infertility is an opportunity to grow. It's a wake-up call. Some people get cancer, some people get a divorce, some people have financial disaster. It's an opportunity. I don't call them a gift because nobody would ask for that. So don't call it a gift. Since we spoke last, I fell off a dock and broke 3 ribs. I'm all healed now. And when I was lying on the dock, one is later on, a friend said to me, "What?" Because I told them my experience, and they called it a gift, and I was like, "Oh, I'd like to re-gift that to you then, if you think it's such a gift." Because I got to tell you, that was the most painful experience of my life. But what happened to me because of this work that I do, I practice what I preach. While I'm in terrible pain on the dock, and while I'm thinking, I'm sure I punctured a lung. I didn't, by the way. I ended up with just 3 broken ribs. But the first thing that happened is I went into gratitude because right away as I laid there, I knew my date of birth. I knew who I was. I knew where I was. I knew what happened. I knew how much harassment I'm going to get from my buddies. So already I knew mentally I was good, right? And I could move my limbs while I laid there. So I knew I didn't break my spine or anything like that. I just thought I maybe punctured my lung. And I went into gratitude, how fortunate I feel because it could have been so much worse. And while I was in incredible pain, I was not suffering. I wasn't like, I'm an idiot. Oh, I got to take off work. Funny thing, be careful what you wish for. A week or 5 days before this happened, I had been thinking that I really want to take a good week off guilt free. This is a lesson that be very specific for what you asked for because I got to take 10 days off guilt free, but that's not really how I intended to do it. And so while I was in there, as I laid there, I chose to use the pain as a portal to presence. I was like in so much pain. I'm like, I'm just going to focus on it. And I just breathed and noticed it. And then all of a sudden, this is where I say inspire thought comes through you. Your body wants to live. I was like, hey, I know first aid. So I called this guy over, asked his name, and I was like, hey, check me for bleeding because I knew I didn't break my limbs. He goes, what? I go, look at my head, look at my ears, touch my pants, like check me for bleeding, right? Then I
Right.
got to take my phone out and call an ambulance and all
Wow.
that stuff. But that's called being present. But life happening for you. It's not always roses, but those are big waves that happen. But I was on the paddleboard and I was able to ride those waves. So this work gives you emotional resilience. So when life throws you, the cliche, lemons, you make lemonade.
Right. And so many patients going through fertility, their first interaction with the medical world is as a fertility patient. And a lot of them haven't developed these skills. So I think patients who are starting their journey should really use this as an opportunity to think of this as a spiritual journey and to learn as much about themselves and how to cope and build resilience at the same time. So hopefully everyone's going to listen to this episode because I'm certainly feeling so inspired and learning so much from you. And I'm going to use a lot of the tools that you've taught me today with my patients.
Thank you.
So I want to talk about psycho-neuro-immunology. First of all, what does that mean?
P&I, psycho-neuro-immunology, and now I've heard it changed to PENI. So, but here's the idea, PENI, let's call it. So your thoughts and feelings impact your endocrine system, your hormonal, your nervous system, your immune system. That's basically what it's saying. So basically that modern medicine has now confirmed, validated what the sages have said for thousands of years, that
Mm,
your mind-body connection. But
totally.
God forbid they would actually say, hey, there's a mind body connection. They like to give it a nice term called PENI,
Someone
psycho-endoimmunology,
has
whatever
a
it is.
sense of humor, or they think they're really funny, but
Yeah.
yeah.
So it
Oh,
makes it sound so now they don't sound so woo. It sounds very medical. Like, oh, I have,
you're
of
right.
course this is true.
And of course, it affects your cortisol levels. It affects
Yeah,
your sleep, your relationships with people, your relationships with yourself, everything, your pain, your periods, your
all
quality of
that stuff.
ovulation, everything, your
Yeah.
implantation window, everything.
So when you have a thought that and now we talked about the lens, so you have a meaning, so because it's never the event that causes the stress, it's how you perceive it. So because we know multiple people can witness the same event and all have a different experience. So it's never the event, it is your perception. For example, look, there are certain things that happen that no matter how sensitive or not sensitive you are, you're going to be the effect of it. Child abuse, sexual abuse. But there are certain things people come into this world very sensitive. And it's a common thing in my practice when I regress people that their abandonment comes from their parents showed up late picking them up from daycare, right? That's their abandonment. Somebody who's not that sensitive, that would not impact that child. But if you're born really sensitive, that can do that. And so it's how you perceive the situation that causes the stress inside the body. And it's more and more documented that fertility causes stress or trauma, can be perceived that way. But if we just follow the mechanism, you have a stressful event, the body perceives it as an alarm, then you have the body reacting. So here's the hormonal immunal approach. So you release, body's an alarm, so it releases cortisol. Cortisol affects blood sugar regulation, which can affect other hormones, leads to chronic inflammation, which we know chronic inflammation can lead to many diseases, which can also lead to suppression of immune system. So now you have all these stress hormones, which turn on and off genes for disease and subfertility. If you're able to experience the joy and lower the resistance, so feel safe, not an alarm, then you get more of the serotonin, oxytocin, dopamine, which turn on and off genes for healing, longevity, and reproduction. So
Yeah.
that's would be my simple reason that don't ignore your thoughts and feelings. It's like a little smoldering fire underneath, and every once in a while it burns up.
And I just literally tell patients happy eggs are healthier eggs,
Yeah.
and just believe that. So, like, I'm a total weirdo too. I accept it. And I tell my patients, your eggs are so beautiful. And if they have a partner there, I say, please talk to their eggs and tell them how pretty they are. And I want you to truly believe that. And there's just something about it. And I feel like, of course, not every person that tells their eggs they're beautiful is going to end up with a healthy embryo. But I feel like just that the positive affirmations that you give yourself, I think it's part of the PENI method, so to speak,
Yeah.
that can help patients with their overall health.
Be kind to yourself is what you're saying. Love yourself.
Yeah.
Take your fingers, kiss them, put them on your ovaries, kiss your ovaries, right? Be grateful for them,
Oh
right?
man, I'm gonna have to steal that from you,
Go
Lauren.
for it. I'll tell you where I thought of that is I was listening to a TED Talk, and I don't remember, she was training, maybe a psychology training, and positive thinking training, and she developed brain cancer, and she took up a relationship and started practicing gratitude for her brain and kissing her brain, and right away, because of what we do, I was like, yeah, kiss those ovaries. Have gratitude for them. They're working hard. They're trying their best.
This is incredible. Yeah, I'm all my patients are gonna be walking around kissing their ovaries.
Kiss their
They're gonna
ovaries. Yeah.
fuck the french fries, you
Yeah.
know? Kiss your
Kiss your
fucking
ovaries.
ovaries and kiss your uterus
Yeah.
all
And
over.
you listen, a week ago, so weird. There's people I've interviewed about remote healing and remote viewing.
Mhm.
So, while your embryo's sitting in the lab trying to grow out to blastocysts and you're thinking it's not going to work and you're freaking out and crying, that's the notice, accept, choose again. Notice, accept. So have your tears, bring the resistance down, surrender, then choose again. Why don't you send some loving thoughts to that embryo in the lab and not be attached to form an outcome as part of consciousness? So I'd love to be your parent. I'd love if I'm the right fit, enter this body. Let's do this, right?
Right.
Send it love, unconditional love, whatever you can do. When you do the affirmations, the key is to have those good feelings. And so another digress that my brain ADHD, I'm always going to digress, but I talk about like baby manifestation or manifestation in general. And this NAC is like step 4. So the first step is knowing what you want. I call it setting your GPS with the end in mind. So having a baby. Then you add an emotional charge behind it. So I bring this up because you have to feel it. If you're sitting there kissing your ovaries, but you're in fear and lack, and then that's not doing anything. It's the emotions that puts the charge behind the thought. That's like the beacon that goes out there. So if you're saying, I believe I have a baby, but your subconscious says, no, I don't, no, I don't, then you're not sending anything out there, right? So really, to put it on a cellular level, you have to practice, you have to dismiss the current reality temporarily and allow yourself to imagine the future as if it's now, and that you have your baby and what will be different. And the litmus test for any type of manifestation is when it arrives, you don't feel differently because you've been practicing that feeling all this time before it arrives. So when it arrived, you've already been feeling that way. There's no like, it's not a surprise. And so the emotions are key. And then then you get into the state of believing it's going to happen. After you practice, it's happened. And then step 4 is if you feel the resistance, like you just don't believe it, and you got these nagging thoughts and feelings, then we NAC that underlying belief or feeling. And then when the resistance drops, we go back into the steps again, which is to choose again, set your GPS, feel it, believe it. And then remembering not to be attached to form and outcome. And to me, that is that this or better is going to happen to me, right? So if you're attached to form and outcome, then you're trying to play the universe, God energy. So be open to other ways for things to come to you that bring the joy, bring the love, bring the purpose, whatever it is that you think it is. Don't restrict yourself, because conscious work requires you to be in the unknown and uncertainty, which doesn't feel comfortable because it's unfamiliar. It's not that it's bad, it's because it's not familiar, it can feel uncomfortable.
So tell me more about the one-on-one work you do with patients. So if I have a patient that lives in California, for example, how do they work with you? Because I've already learned so much from you on our call. I'll be kissing my ovaries, my uterus, like for the rest of the day. Okay. And I imagine people will be listening to this and their minds will be blown as well. And they want you to NAC this shit out of them. So how do we make that happen?
So if somebody is out of town, then they just set up a telehealth. And what I do in those, I have an initial consult, I get their history, and then we find out what we can do to nourish the soil. And so they may want to know about supplements, Chinese herbal medicine, acupuncture, laser, IVF. And that's where I share the resources that I have around the world, because I can't do the acupuncture laser if you're out of town. Some of them do come into town and see me, but for out of town, I direct them, oh, here's people you can go to. Hence why you see a lot of people that I've referred, because I'm like, oh, you want some PRP? Check out Aimee. You want the Tushy method? Check out Dr. Aimee. Exactly. You want your ovaries kissed? So I can do that remotely. And I basically am like they want a second set of eyes. Sometimes they're seeing somebody, and I just go through it and see what they're doing. And then I can share other things that they could be doing. And then if they want to do the conscious work with me, the belief change work, they just set up a series of sessions online. And usually we do at least 5 sessions. That's common to do 5 sessions to see some shifts. If they're in person, I treat 2 ways. Either I just do a session without conscious work, so they get herbal recommendations, dietary supplements, acupuncture, and low-level laser therapy, and that's those treatments that I can do hands-on there. Or they can do another type of session where they get that, plus they get the conscious work. The difference is when I just see somebody without the conscious work, I'll run 2 or 3 rooms. So I'll get the laser set up, the acupuncture, I talk, and then I go to other rooms. When I do the conscious work, I don't book anybody else parallel to them. So I'm with them for the full time, so I can facilitate conscious work.
Awesome. That's incredible. And then I actually think that you could help couples as well. I imagine the work you do can also heal relationships. Can you tell me a little bit more about that?
Yeah, I'm smiling because I never do relationship work with them together, because it only takes one person to be conscious to heal a relationship. And so, 2 things that happen in conscious work. One is we heal trauma from their childhood, and then we work on the real strong hit they have on their husband.
I call it the Kevlar vest.
So
I'm
the
like, which one of you is
my
wearing it tonight? And I'm not joking.
my teacher, Gila Golub, she says relationships are not here to make you happy. They're here to make you conscious. So they're your greatest teacher. And to share some stories, when people do this work, because again, I promise one of two things happen if the shift happens when you really do this work. One is your perception to the situation changes, and two is the external environment changes. So the first one is your husband, it just doesn't bother you what he's doing. Like you just don't see, you're literally not triggered. You're not ignoring it. You're not suppressed. You're not triggered by it. You feel differently based on it. Or two is his behavior changes. So I've had patients where all of a sudden, their husband started baking scones for them. I've had ones with their kids. So some already have kids and they're looking for other children. I have people that come in that aren't trying to get pregnant, by the way. I don't just treat fertility, where they have young kids and one kid has terrible fear sleeping on their own, and one of them has to sleep in the hallway. And through this work, the child says, I want to sleep on my own, the light off. Child wouldn't let parents come watch them play sports. Then all of a sudden the child asks their parents to come to the game without the parents saying anything. They do the work. So you're like Wi-Fi. The environment is your mirror. It's a reflection of what's going on in you. So everybody thinks I got to go work on the outside to feel better. This was actually my aha moment when I discovered conscious work. I was always a seeker. When I was a CPA, I was still showing up at these mind-body workshops. I was in my 20s and it was all women in their 40s that at these retreats. And I was learning, like, wow, husbands bad at these retreats. But I was always a seeker. But it wasn't until around 2014 where I made this like my PhD, my mission, my capstone. I just make it a full-time job for myself. And through this conscious work, you have the shift. And why it was like aha moment, I had relief, is I got the message that I had been trying to change the external world to feel good. If just my staff were this way, if just the government was this way, if just my wife was this way, then I'd feel better. And then I realized if I just change me, then my perception to everything else would change. And I was like, shit, I can make me a full-time job. That's a lot easier than trying to change everybody else. So for conscious work, when it comes to relationships, it just takes one person. Why? Because when the person who is conscious is in a relationship, one is they don't need their partner to be a certain way for them to feel good. And neediness is really uncomfortable. It's unattractive. So the partner's not feeling that need anymore because you're tapped in, getting it filled another way. You're not looking for them to fill you up. Two is, remember, notice, don't take it personally. When your husband is an ass, you're curious what's going on for them. How old are they in this moment right now? Like, what program are they running? And you're not making it about you. You're not taking it personally anymore. So you're not at the effect of it. Right? So that's why it helps. And the other person has temporary relief because every human being wants to be seen and heard. That's how we feel love. This is to quote Gordon Neufeld, a local attachment therapist here in Vancouver, also on the Conscious Fertility Podcast. So when you're conscious, you're able to be present, hold the space, and hear them. You don't need them to see and hear you because you already do that for you. So when you become conscious, you're no longer looking for the external world to validate you. Yes, it feels good when it happens, but you're very clear that those are temporary pleasure feelings. They're not your nature. When I talk about you are happy, your very nature is peace and joy. That's why you're happy. So you're tapped into that. When you get a raise, when somebody pays you a compliment, when you get a blastocyst that's an euploid embryo, that's temporary pleasure. That's external. So you're still being affected by the external. You're happy. Oh, it's not euploid. Now you're not happy. When you're conscious, you still don't like it, but you don't get this big trigger, or it's a slow trigger. And so as you rewire the brain, being a slow trigger, remember I said how fast it is, supercomputer? As you prune the old programs, the old synapses, and you rewire your brain, it can be a slow trigger. So as you're starting to feel the volcano or feelings change, you can catch it and shift it right away, and it never takes hold of you. I don't remember your question, but hopefully I answered it.
Oh, no, I mean, answered it I mean, the question was healing relationships, and
Okay.
you're amazing, and we love
So
you.
yes, I work with women who are in relationships, same-sex relationships and heterosexual. And they always ask, I want my husband to come in. He has to do this. And I say, he will come in when he sees the change in you. He may ask, but you don't push it, right? Because again, you're trying to change him. And there are men that come in because they basically say, I don't know what you do, but I want what my wife's been getting. Right? And if you ask your partner, like if your partner asks you, hey, what are you doing? Then you can mention it. And if they're receptive, then tell them about it, but don't push it. If they're not receptive, then just change the topic and say, would you like some tea?
Right. I love it. Like some tea. Well, thank you, Dr. Lorne Brown, from Acubalance Wellness Center in Vancouver, British Columbia, Canada. We love you. Thank you for all the work that you do. And I have a feeling that this podcast episode will be shared for years to come. Thank you, Lorne.
Thanks for the opportunity, Aimee. All right, so there was the episode that I originally did for the Egg Whisperer for Dr. Aimee. I know there's another episode where she's interviewed me on laser and photobiomodulation for fertility. And I also have 2 episodes on the Conscious Fertility Podcast where I talked to Dr. Aimee about PRP and just her whole method, the Tushy method as well. So do look for those other 2 episodes on the Conscious Fertility Podcast with Dr. Aimee, and go check out the Egg Whisperer to hear the great guests she has on her episodes, including 2 that I've done with her as well.